Hello.
And also, what was your name again?
Paola, Dr.
Paola.
Alfaro. My last name is Alfaro.
Alfaro.
Yeah. My
Paola
first name
Alfaro.
is Paola.
Okay, Paola.
Nice to meet you.
Nice to meet you too. To you. Okay. Then, do you have any question about the treatment or about the application or the function of the stem cells or PRP?
So with the PRP, so that is my plasma that you guys just took just now. It will come from that?
No, tomorrow.
Tomorrow.
We need to take again.
Okay.
Because we need to put in the machine for do the
Spin it in the centrifuge,
spin it, yeah.
right?
And then that machine separate the cells, the red blood cells,
Right.
and the plasma is more like the liquid.
Right.
And in that part, there are the platelets with the growth factor. So
Right.
we need to take from that.
Okay.
Must to be. We need 8 hours for use that plasma. So
Need to use it within 8 hours of drawing it.
yeah. So I can take now and put it tomorrow.
Oh no, we can just wait till tomorrow.
Yeah, because for that reason we need to take twice.
Okay.
Blood. Just this is for your blood work and tomorrow for the PRP.
Okay. And the blood work we just took now is to make sure that I'm healthy to receive all the treatment tomorrow.
Yeah, it's like a general blood work. I mean, from your glucose, the function in your kidneys, your liver, the
Right.
thyroid levels. We take a prostate marker, which is a muscular marker from cancer, and that, and like in general for your blood cells. I mean, because we don't have to use the stem cells if you have acute infection or inflammation.
Okay.
Because like the stem cells target inflammation, that's gonna work with
Right.
the acute, and we need the effect of the stem cell for your chronic
Right.
inflammation, right?
Right. And I've seen that reading and researching a lot. So sometimes they'll do liposuction on people to then put their own stem cells, their own MSCs into them from their adipose fat, and it will just, the MSCs will go straight to their liposuction, and then they don't do the work on the chronic condition, which is bad.
I mean, we have option for take the stem cell from your body. One is the fat tissue, bone marrow, or another tissue like teeth, like uterus, menstrual, placenta, umbilical cord. We have too many tissue for take the stem cells, but with the fat tissue, it's another procedure. So we don't know exactly how many stem cells we get for that.
Right.
I mean, it's more complicated.
Right.
And is that age of your stem cells is like your age.
Right.
So
that's why I'm not doing that. Yeah, I want the ones from the little babies. Day zero.
So the laboratory we work, they do this for 16 years, and they work with a fertility clinic.
Right.
So they knows all the patient, I mean mom and babies, for all during all the pregnant labs, and just for see all like healthy, right? But when they get the tissue from the stem cells, they send to like a double check for see if the tissue is free for any bacteria or virus infection, and there is like markers the stem cells has, and they see if they get a real mesenchymal stem cells, then they send us to a certificate of quality and all describe all that stuff I told you. So they cultivate the stem cells.
Right, up to 9 times, right?
Mm-hmm.
Yeah.
Because they have the character. I mean, they can duplicate fast.
Right. About every 28 hours for the day zero MSCs, right?
Yeah.
Yeah.
You should read about that.
Oh no, I've done a lot of research. This is, and we're recording so that people can. So what this is here, guys, is
this
these.
is a certified of quality.
Right.
With the stem cells, we work with the laboratory CryoVida. That's the name. So here, well, this is a presentation they use. It depends if it's for joints or IV or aesthetic, because we're using aesthetic too for face or hair. And then here say the test of virus is HIV, hepatitis, syphilis, and Chagas, and all must to be negative, right?
And is this just an example, like, por ejemplo, or is this paperwork the actual MSCs that will be put into me tomorrow?
Yeah,
this report.
It's like this for you tomorrow, but with a different alote because it's your stem cells and the date.
Okay.
But it's
it will be very similar.
Yeah.
Right.
It looks like this.
Right. Okay. And one thing that I've researched quite a bit is each one of these CD numbers here, CD 34, 44, 45, there's so many different ones here, and they all do different positive things to varying degrees, and we still need to do a lot more research on them, but they're all very good. So as the science progresses, we'll be able to target even more like what your problem is and target them with the specific CD number that they would need even more.
Yeah.
Is that fair to say?
Yeah, there is an International Society of Mesenchymal Stem Cells. Then they say if you need to prove you have a real mesenchymal stem cell.
Right.
It's because the mesenchymal stem cells have specific markers.
Right.
Because there are too many kinds of stem cells.
Right.
But this is a mesenchymal, right? So it must to be positive to these markers, CD44, CD73, CD90, and CD105.
Right, because you can see those are the ones that have the very high percentage, and the 45 and the 34 are very low.
And must to be negative to these both markers, CD34 and CD45, because these both are specific for hematopoietic stem cell.
Right.
So we don't want that in our case. So in general, it must be the 99, well, in this case, with this tissue, 99.46% mesenchymal stem cells.
Right.
Because you keep all that tissue, in some tissue, I mean, it's like less than 1%. We don't want that. But this is a, like certified, you have a real mesenchymal stem cells, and they see for the cytometry, this kind of is a technique for see this. And this is like a bacterial test. This it says here endotoxin, bacterial endotoxin, and mycoplasma. I mean, must to be negative. And this is a show that your test. I mean, from these mesenchymal stem cells, it must to be without tension, negative, right? So this is like a double check, make sure that it's safe, and you're sure that you have a mesenchymal stem cell and without infection or any risk for tissue.
Perfecto. And I think I saw on the Dream Body Clinic YouTube channel, I think I saw you get some MSCs in your knee.
Oh, for me? Yeah,
from a few months ago.
I'm training.
I've watched all the videos.
Really?
I'm a voracious YouTube video watcher.
Yes, you are.
Yeah, on training, a doctor do the knee application for me.
Yes.
I need to tell you, the doctor do a little wrong, touch my bone.
Oh.
Yeah, and I feel so much pressure. I know you feel pressure sometimes because it's a liquid inside your joint.
Right.
But I was, after that, I was still feeling like so much pressure, and when I see where was the, I see it's not in the correct place.
Oh.
I mean, we were on training.
Right.
It happens. It's better in between us and not with the patient.
Right.
And then the first week was pain, sore, but after that, feel great because I have a lesion in my meniscus, in my left knee, and no pain now. So
wow, that's
it was
great.
like 2 months ago.
Yeah.
I think.
Yeah, I think. Have you had a follow-up MRI yet, or?
No, because I don't. When I was on training, I'm not prepared for do a patient.
Okay.
So it wasn't a moment. So I don't have an MRI before.
Right.
Now,
But you know what you feel. You know that your knee's better.
Yeah.
Yeah.
I mean, when we use the PRP and mesenchymal stem cells, sometimes we don't have a real marker for see the difference.
Right.
But for us, the biggest marker is how do you feel, how do you the function in your articulation, or it depends your issues.
Right.
Is I mean, how do you feel and see the difference after and before and after to use our treatment. But we prefer to see with like a visual
Right.
proof.
To have the evidence.
Uh-huh.
Yeah, the
The
MRI.
evidence
Well,
is
unfortunately, I'm being bad. I didn't want to pay extra for the MRI. I wanted to save my money to get more treatment. So I'm not going to be getting MRIs on my. I'm going to be doing my right ankle, knee, and shoulder. I know that they need some healing and some work. It'd be nice to have the MRI, but I just don't want to pay extra for it. I'd rather save the money at this point in time.
So it's the best way, right?
Yeah.
To see the difference, because in the case of Josh, because we want to show that,
Mm-hmm.
he has a MRI from June, I think,
Yep.
and a patient lost the appointment for the ultrasound, so they pay, and then Josh go
Went ahead
to
and
the
did it.
ultrasound just
Right.
for see, and looks real better.
Right.
For a few months, I mean, it was in June. It's like 5 months ago.
Yeah, for his knee, right?
Mm-hmm.
Yeah, I heard him talk about that.
Then I told Josh is better another MRI, so for see the specific, right, with the same level of the
Right. I mean, it grew back cartilage, which mainstream science says is impossible, but it's not with this type of treatment.
There is a specific article says with a patient, with a few patients, use the application with the PRP and stem cells in knee,
Mm-hmm.
and then follow for 2 years with the images, so see the difference
Right.
with the before the application, and 1 year and 2 years, and then they prove that at least 2 years is still working the stem cells to grow in cartilage.
Right.
So sometimes ask me for how many time works, and I say, well, at least for 2 years.
Right.
We don't know how.
But it has to do with each individual. The younger and healthier you are,
Yeah, I mean,
the better it's going to be,
Mhm.
like anything else. And that's something people just don't fully understand and think about. If you're in your 70s and if you have osteoarthritis and your body's old, you're probably going to need them every 3 to 6 months rather than every 2 to 5 years or something. Yeah. So.
We'll always talk about that too, because or some patients need a surgery, right? And they don't want, or it's a big risk because the age or chronic disease. I mean, it's too many factors involved. But we always say, well, if your doctor says you need a surgery, you need to think about it. I mean,
Right.
the stem cells is like a complementary treatment.
Mm-hmm.
And different stage, right? If, like you say, if you're younger, if the stage of your injury is the first steps, then you have more chances to.
That's why
be
I'm here right
successful.
now, because this is preventative medicine. That's what I want people to really understand, preventative medicine. So I sprained this ankle when I was 20 years old, 3rd degree, really bad. I didn't get physical therapy at the time. It never healed properly. And I'm 33 years old, so I've just been dealing with it for 13 years. And now that I know about this, I say, I'm tired of waiting. I want this to get healed properly so I can move on with my life and have a normal ankle again. And basically, same thing with my knee. I never had one particular moment where I hurt my knee, but it's just been getting worse as I get older. And same thing, my shoulder. I've played baseball since I was very young, and now I've been playing dodgeball as an adult for the last 8 years, kind of like competitively. So I know my shoulder just needs some good healing to go on. So that's why I'm here.
Right.
For the local injections. And then, of course, I want the infusion for my lungs, my heart, my organs, and then anything else that the MSCs can detect. I prefer to call them medicinal signaling cells. I know you guys call them mesenchymal stem cells, but
Yeah, but that's the correct name.
Yeah, Arnold Palmer is the guy who kind of discovered these and named them in the 1980s, and he's on a mission to rebrand them medicinal signaling cells. And the more I've learned about them, I realize that's really what they do. And the problem in America is that stem cells have a lot of negativity towards them because of embryonic stem cells. So I think by renaming these medicinal signaling cells, we can move away from stem cells and just focus on this, because this is a completely different thing, and that's very important in branding and understanding for people that these are not embryonic pluripotent stem cells. These are multipotent, and they are pericytes. They're not a parasite, P-A-R-A-S-I-T-E. They're pericytes, P-E-R-I-C-Y-T-E. So they kind of attach to your blood vessels, and they just really get all your other cells to behave properly, to do what they're supposed to do when they're younger and more active. They're kind of like a manager on a job site that get the rest of your cells to go to work and do their jobs. Is that fair to say? When the
mesenchymal or stem cells goes, it's like on church.
Right.
And say what to do. I mean, the best way or the current form to do it's like with the baby.
Mm-hmm.
It's always on rowing.
Right.
So need to prepare all the organs and tissue and function in your system. So
yes,
that's the function from these cells, right?
Yep. And have you done the IV as well, the infusion?
For me, just 10.
Okay.
Yeah, 10 millions in IV. It's just one shot.
Yeah.
You don't need
The full IV drip.
Yeah, or the saline solution. Nothing. Direct to your vein. And I did that. But
Okay. Did you have any questions, Mrs. Camerawoman Lauren?
I think I'm okay for now.
Okay.
Right.
Anything else you wanted to share with us or go over at this point?
Well, I think about the PRP.
Mm-hmm.
Because the function with the PRP, or what we want from that, is the growth factors.
Right.
So the growth factors from the platelets have inside that growth factors. So when goes to any inflammation or infection or a trauma, then release that growth factors.
Right.
Breaks and release that growth factor. So that is what we do with the machine, like
The centrifuge, right?
Yeah.
Mm-hmm.
break the platelets, and then the growth factors are free on the plasma, right? And goes direct to your joints. We use that only in joints.
Right.
Or topic. I mean, in facial with the dermapen, we use the dermapen.
Right.
Or in hair with the derma roller.
Right.
So, because PRP can use from IV.
Right. You never want to do that intravenously.
No.
Yeah.
And then we add calcium gluconate.
Right.
Because active the PRP.
It activates the PRP like 187 times more than without it, right?
Without that.
Yeah.
Yeah, because
which is huge.
It's
so
a
if you're
big
not doing
difference.
that, then the scientific research shows that it's 187 times more effective when you do it with
the calcium.
right, with the calcium gluconate.
Yeah.
And so if you look at a lot of studies of saying, oh, PRP, doesn't work with the MSCs, the medicinal signaling cells or mesenchymal stem cells, it's probably because they weren't using the calcium gluconate, which is 187 times more effective. That's a huge difference. So that's the reason I'm sitting here right now and she's sitting here right now recording this, is because we've done our research, and to this point in time, you guys are doing phenomenal work with this technology at very affordable prices. So we really appreciate it.
So we wait for you tomorrow and do all the application with you.
Yes.
Okay.
I think Josh said when he gets free sometime today, we'll come back here to chat more. So I don't know if you'll be here, if I'll be chatting with you at all more today, but
I think just tell me what time. I don't know if you know what time you come back.
He said for tomorrow morning, 9 a.m. is when we'll get started.
Okay.
But he said today, when he gets free, he wanted to sit down and chat a little bit more. And we're free. We're just staying at the hotel
Yeah,
right down
so
the road.
you're-
Oh yeah, you probably know all the wristbands and yeah.
They
Yeah.
gave us a wristband, yeah.
Yeah, it's an all-you-can-eat and drink, like all-inclusive place that we're at, but we're not doing that. So we just get the sad, clear one. I think is it blue where they have I think we saw some people with blue wristbands laying back, drinking margaritas and eating, so. Do you have a blue Sharpie by any chance?
All right, I think I'm going to turn this
Okay.
off.